Do this right now. Sit still. Place 2 fingers on your wrist. Count a few beats. Now look at the blood pressure cuff near you, or picture the one on your kitchen table. Do you know only the pressure number, or do you also know what your pulse is telling you after Metoprolol, Atenolol, or Telmisartan? It did not begin like an emergency, it crept in quietly. The morning pill organizer looked the same. The blood pressure reading looked better. Then noon fatigue started. Cold fingers appeared while washing dishes. Standing from bed required one hand on the doorframe. A low-sodium salt substitute sat beside breakfast. Ibuprofen stayed in the bathroom cabinet. The number on the cuff was recorded, but the pulse, dizziness, weakness, and sick day plan were missing at the very moments family expected steady strength and confidence. Here is what I need you to hear. A blood pressure pill is not just a number-lowering tool. It is not a vitamin. It is not interchangeable just because the bottle says blood pressure. Your body does not slow the heart, change kidney signals, shift potassium balance, or drop pressure when standing for no reason. Same goal, different pathway. And the most surprising part is this. The real trigger may not be in the blood pressure number at all. You may see a clean reading on the screen, but the signal can be coming from your pulse, your kidneys, your fluid level, your diabetes warnings, or a product sitting quietly on your kitchen shelf. In my work with older adults, I have seen this pattern misunderstood over and over again. For 25 years, I have watched careful seniors take medicine exactly as prescribed, yet miss the one clue their doctor needed most. Do not stop or change Metoprolol, Atenolol, Telmisartan, or any blood pressure medication suddenly without your doctor or pharmacist. Today, I want to help you read that pattern, and we have science behind this. In the NIH-sponsored SPRINT trial, researchers studied 9,361 adults aged 50 and older with high blood pressure and elevated cardiovascular risk. Lower pressure targets reduced major cardiovascular events, yet intensive treatment also produced more serious hypotension, fainting, electrolyte problems, and acute kidney injury. In simple terms, a better pressure number still needs context because safety lives in the pattern around the number.
By
Today,
understanding these patterns, pulse, kidneys, potassium, and your plan, we can avoid any mistakes before they happen.
What Telmisartan means for potassium and kidneys, which symptoms deserve a call, which ordinary products deserve review, and why sick days change the rules. But I am not going to reveal the most important connection yet, especially the quiet overlap behind mistake 5 and mistake 3. My name is Dr. Thomas Bennett. At Senior Health Daily, my promise is simple. Calm doctor, led guidance, plain language, real research, and practical steps older adults can discuss with their own doctor. Before we go any further, drop a comment below and tell me this. Which pattern fits you? M for Metoprolol or Atenolol with pulse, dizziness, or fatigue concerns. T for Telmisartan with kidney, potassium, salt substitute, or NSAID questions. Or N if you are not sure yet. Add your age and city, then write M, T, or N. If you check heart rate, add pulse. I read every single one. Now, one important point before we begin. Blood pressure medicine itself is not your enemy. It is part of your body's protection against stroke, heart strain, and vessel damage. The problem begins when the heart slows too much. Kidney signals meet dehydration, potassium rises silently, diabetes warnings become less obvious, or one frightened reading leads to skipped, doubled, or panic-based dosing after 60. So listen, because the first cause is the one many people miss. In our previous video on amlodipine, losartan, and lisinopril, many seniors asked for this next lesson. The name on your bottle is not just a label. It is a category, and the category tells you what your body is trying to say when the cuff is only the place where the warning quietly shows up. So let us begin with the mistake many seniors never see, because it hides behind a good number. Fact number 9. The bottle says blood pressure, but the body reads category. Metoprolol and Atenolol are beta blockers. Telmisartan is an ARB, an angiotensin receptor blocker. That one difference changes everything the body is trying to tell you. Look at the ordinary objects around an older adult's morning. The cuff may look calm. The pill organizer may look tidy. The glass of water may look harmless. But the body is reading pathways, not labels. The pathway tells us which clue deserves attention first. This is also why two seniors can take the same medicine and tell completely different stories. One feels protected and energetic. Another feels slowed, dizzy, or uncertain. The difference is not imagination. It is dose, age, kidney reserve, heart rhythm, fluid intake, diabetes status, and the other products sitting in the house. A beta blocker quiets the stress signals that make the heart beat harder and faster. That helps many people. It also explains why the hidden clues often show up as slow pulse, tired legs, cold hands, dizziness, less exercise tolerance, and a weaker racing heart during low blood sugar. Telmisartan works through the angiotensin system. It relaxes blood vessels and affects the kidney pressure pathway. Its warning pattern is different. It points toward potassium, kidney labs, salt substitutes, dehydration, NSAIDs, and sick day planning. The Sprint Research Group studied 9,361 adults age 50 and older with high blood pressure and elevated cardiovascular risk. Lower targets reduced major cardiovascular events, but serious hypotension, fainting, electrolyte problems, and acute kidney injury were more common in the intensive group. The on-target investigators studied 25,620 high-risk vascular patients and showed why angiotensin system medicines require kidney and potassium respect, especially when combined. FDA Daily Med, labeling for Metoprolol, Atenolol, and Telmisartan, separates these medicines by different warnings, not by one simple pressure number. That is the lesson. A good blood pressure number is not the whole story if nobody is watching pulse, dizziness, kidney labs, potassium, pain relievers, and dehydration. A composite patient I will call Leonard, 77, from Tampa, thought every pressure pill worked the same way. His cough improved after metoprolol, but by noon he felt as if someone had tied sandbags to his legs. He blamed age. His pharmacist asked one quiet question. Do you track pulse, not just pressure? That question gave him relief, because the problem finally had a pattern. Before we go deeper, tell me your age and the city you are watching from. Are you watching as a senior, as a husband or wife, or as a son or daughter caring for a parent? I am truly happy when you are healthy and happy every day, and this community is here, so older adults do not have to face medication questions alone.
The pressure is good,
Fact number 8,
but it didn't register
a
your
beautiful
pulse.
blood pressure reading can still hide a pulse problem. This is where many careful people get fooled. They write down 122/70 and feel safe. Then they ignore the number beside it. But metoprolol and atenolol lower pressure partly by slowing the heart response. For some seniors, that is exactly why the medicine helps. For others, especially when age, dehydration, other heart medicines, or conduction disease overlap, the pulse becomes the missing clue. Daily Med labeling warns that metoprolol can produce bradycardia and that patients should be monitored for heart rate and symptoms. NCBI clinical summaries explain that beta-1 blockade lowers heart rate, slows electrical conduction, and reduces contraction force. Sprint also tracked bradycardia, syncope, hypotension, injurious falls, electrolytes, and acute kidney injury as safety events, proving that serious blood pressure science never watches the cuff alone. Plainly said, pulse gives the cuff a second voice. I want seniors to understand this before a fall, not after one. A pulse that is normal for one person may be too low for another, so I will not give you a universal cutoff. Your own doctor must tell you what number matters for your heart history, your medicines, and your symptoms. A composite patient I will call Nora, 74, from Des Moines, kept a perfect notebook. Every morning she wrote pressure, date, and time. She never wrote pulse. She stopped walking to the mailbox because her body felt drained. Yet she told her daughter, I am just getting old. When her clinician saw pressure, pulse, dose timing, and dizziness together, the visit changed from guessing to reviewing. Ask yourself honestly, do you know your usual pulse? Do you feel worse after the dose, when standing or during a walk? Do you feel unusually tired with cold fingers or near faintness? Do not decide alone. Write the pattern and bring it to your clinician. Type steady in the comments if you understand this one word. Your health is precious, and a steady senior plan watches pressure, pulse, and symptoms together. Fact number 7. Beta blockers can quiet the alarm of low blood sugar. This matters especially for seniors with diabetes. Low blood sugar often announces itself with shaking, hunger, sweating, anxiety, weakness, confusion, and a racing heart. But beta blockers reduce heart rate response. That means the chest can feel calm while the sugar is falling. I do not want any senior with diabetes using heartbeat as the only alarm. The safer mindset is wider. Sweating, hunger, blurred thinking, sudden sleepiness, irritability, shakiness, and strange weakness all deserve attention when blood sugar medicine is involved. Daily Med labeling for Atenolol states that beta blockers can mask early warning signs of hypoglycemia, including tachycardia, and that severe or prolonged hypoglycemia deserves emergency treatment. Mayo Clinic gives a similar warning, telling patients that Atenolol can cover up fast heartbeat during low blood sugar. A large clinical review of beta blocker safety in diabetes also shows the point clearly. The issue is not that every diabetic patient must avoid beta blockers. The issue is that the warning pattern changes. A composite patient I will call Sophia, 69, from San Antonio, had type 2 diabetes and took Atenolol. For years, her danger signal was a pounding heart. One afternoon, her heart felt calm, but she was sweaty, foggy, and strangely weak while making lunch. She almost ignored it. Her daughter said, "Check anyway." That small moment prevented a frightening afternoon and gave Sophia a new rule. If the body feels wrong, do not wait for the heart to race. Self-check. If you use insulin or diabetes medicine, do you know your current low sugar signs? Does your spouse know them? Have symptoms changed since starting a beta blocker? If this explanation is useful, please subscribe and press like so this senior health community can grow. A community of happy, informed older adults becomes stronger when you receive useful guidance and share your experience. I am grateful for every comment that helps another senior feel less alone. Fact number 6. Stopping metoprolol or atenolol suddenly can be more dangerous than reporting the side effect. This mistake is quiet. A senior feels tired before church, dizzy before a wedding, or slowed down before a family trip. So he skips a weekend dose to feel more energetic. That is not courage. That is risk done in silence. FDA Daily Med labeling for metoprolol warns that abrupt cessation of beta-blocking therapy has been followed by worsening angina and, in some cases, myocardial infarction. The label says, chronically administered metoprolol is generally reduced gradually over 1 to 2 weeks under medical monitoring when discontinuation is needed. Atenolol labeling also warns against stopping without physician advice, especially when coronary disease is present or unrecognized. These warnings exist because the heart adapts to blocked stress signals. Suddenly, removing that protection can let stress signals surge. A composite patient I will call Gordon, 76, from Cleveland, felt heavy and slow on metoprolol. He skipped it before his granddaughter visited because he wanted to be cheerful. The next morning, his heart pounded, his pressure climbed, and fear filled the kitchen. His concern was valid. His method was dangerous. This is the emotional trap with beta blockers. The side effect feels personal, so the senior solves it privately. But the heart does not know the decision was made for a graduation, a church service, or a family visit. It only feels the sudden change. The safer sentence was simple. "Doctor, I feel slowed down." What is the safe way to review dose, timing, formulation, or another cause? Never stop, skip, double, taper, or change. Metoprolol, Atenolol, Telmisartan, or any blood pressure medicine on your own. Side effects deserve a conversation, not a secret experiment.
Look here.
If you are still with me,
Now.
type 4
The
inches
heart
the
rate and
comments,
oxygen levels
because this
are
safety
exactly
map
where
is
we
becoming
want them to
clearer.
be.
If you do not like commenting, type 0. Even that tells me you are listening quietly. Fact number 5. With Telmisartan, a healthy salt substitute deserves a medication review. The danger may not be inside the pill bottle, it may be beside the salt shaker. Many seniors hear that sodium raises pressure, so they buy low-sodium salt. Some of those products replace sodium with potassium chloride. For a healthy person, that may seem like a smart swap. For a person taking Telmisartan, especially with reduced kidney function, heart failure, potassium supplements, potassium-sparing diuretics, or dehydration, potassium is not just a kitchen word. It is a lab value that affects muscle and heart rhythm. Daily Med labeling for Telmisartan states that hyperkalemia occurs with ARBs, especially in people with advanced renal impairment, heart failure, renal replacement therapy, potassium supplements, potassium-sparing diuretics, potassium-containing salt substitutes, or other potassium-raising drugs. NCBI medical references define hyperkalemia as elevated serum potassium, often above about 5 to 5.5 milliequivalents per liter, and warn that significant elevation can disturb muscle and cardiac electrical function. On Target reinforces the same kidney potassium lesson at human trial scale because combined angiotensin blockade increased hypotension, syncope, renal dysfunction, and hyperkalemia. A composite patient I will call Marisol, 78, from Tucson, proudly replaced table salt with a low-sodium substitute. She also took Telmisartan, no one knew, because she did not consider the shaker a medicine. When her son put the container into her medication bag, the pharmacist finally saw the missing piece. Marisol was not careless. She had been uninformed, and that is very different. Potassium problems are especially deceptive because they do not always announce themselves early. Some people feel fine until labs show a change. Others notice weakness, heavy legs, palpitations, nausea, or unusual fatigue. The point is not to fear every banana or vegetable. The point is to review concentrated potassium products with Telmisartan. Tell your pharmacist about salt substitutes, electrolyte powders, potassium pills, sports drinks, mineral drops, and meal replacement shakes. If you have your own story about a salt substitute, supplement, electrolyte drink, or medication question, write it in a longer comment. I respect your story. Your story can give real benefit to this senior community because someone else may recognize the same hidden pattern. Fact number 4. The pain reliever on the shelf can change the kidney story. The kidney does not care whether a pill came from a prescription pad or a drugstore aisle. Ibuprofen and naproxen are NSAIDs. Seniors use them for knees, hips, shoulders, back pain, and sleep-stealing arthritis. I am not saying nobody can use them. I am saying regular use deserves review when telmisartan, dehydration, kidney disease, diuretics, heart failure, or older age is part of the picture. Daily Med labeling for telmisartan warns that NSAIDs can reduce the blood pressure lowering effect and increase the risk of renal impairment, especially in elderly, volume-depleted, diuretic-treated, or kidney-compromised patients. A BMJ nested case control study by Francesco Loppi and colleagues found that combining a diuretic, an ACE inhibitor or ARB, and an NSAID was associated with a 31% higher rate of acute kidney injury, with an 82% higher rate during the first 30 days. A New Zealand primary care review reported that in 2017, 115,980 patients received long-term ACE inhibitor or ARB plus diuretic treatment, and 26,526 of them also received an NSAID, showing how common this overlap becomes in real life. A composite patient I will call Evelyn, 73, from Atlanta, used naproxen 3 nights a week for knee pain. She took telmisartan and a water pill, but when asked about medicines, she said, nothing new. To her, naproxen did not count. Her safer change was not suffering through pain. It was asking about acetaminophen, topical therapy, physical therapy, braces, heat, and kidney lab monitoring. That distinction protects dignity. Seniors should not be told to simply tolerate pain. They should be given safer pain strategies that fit their kidneys, heart, stomach, bleeding risk, and daily mobility. Self-check. Do you take ibuprofen or naproxen even once a week? Do you use it more when you are hot, dehydrated, sick, or not eating well? Bring that truth to the pharmacist. Please share this video with one older adult who takes blood pressure medicine and uses pain relievers. And turn on notifications, because this channel keeps bringing practical medical knowledge for seniors who want safer aging and longer independence. Fact number 3. Illness, heat, vomiting, diarrhea, and poor drinking change the body your pill enters. The pill did not change, the body changed. After 60, a stomach virus is not just a stomach virus. A hot afternoon is not just weather. Vomiting, diarrhea, fever, heavy sweating, poor appetite, and low fluid intake reduce the volume that blood pressure medicines meet. Telmisartan becomes more complicated when kidney blood flow is stressed. Beta blockers can make the standing response feel slower. This is why disciplined seniors still get into trouble. They do everything exactly the same when the body is no longer the same. Daily Med patient counseling for telmisartan warns that inadequate fluid intake, excessive perspiration, diarrhea, or vomiting can lead to an excessive fall in blood pressure, lightheadedness, and syncope. Mayo Clinic lists dehydration, vomiting, diarrhea, and kidney disease as conditions requiring caution with telmisartan. Sprint again reminds us that pressure lowering needs safety surveillance because hypotension, syncope, electrolyte problems, and kidney injury were watched as real outcomes, not minor details. A composite patient I will call Bernard, 81, from Fresno, was proud that he never missed his pills. During 2 days of diarrhea, he kept the same schedule and drank very little. Then he stood up, saw black spots, and nearly fell against the refrigerator. He did not need less discipline. He needed a sick day plan before sickness arrived. Do not create your own stopping rule. Create a calling rule. Write the after-hours number before you need it. Keep it near the pill organizer. Tell one family member where it is. During illness, clear instructions are safer than memory, pride, or guessing while weak. Ask your clinician what to do if you cannot keep fluids down, have vomiting or diarrhea, sweat heavily, feel faint, or see very low readings with symptoms. Before we move forward, make sure you are subscribed. Then comment one question you want a doctor to explain more deeply about blood pressure medicine. I promise to read each comment and respect this senior health community because your serious questions and experiences help others learn. Fact number 2. Dizziness when standing is not always just getting up too fast. A few seconds can steal confidence. When you stand, blood shifts downward. The body must tighten blood vessels, adjust heart rate, and keep enough blood flowing to the brain. In younger bodies, that adjustment is often quick. After 60, arteries stiffen, reflexes slow, muscle pump strength changes, and medicines add another layer. Beta blockers slow the heart response. Telmisartan lowers vessel resistance. Dehydration lowers volume. Together, they can turn standing into a real test. A 2021 Age and Aging systematic review screened 5,136 articles and included 13 studies with 5,465 older adults. It found initial orthostatic hypotension in 27.8% of older general populations and 35.2% of geriatric outpatients. A separate review reported orthostatic hypotension in roughly 1 in 5 community-dwelling older people and almost 1 in 4 older people in long-term care. Clinical studies connect these drops with falls, syncope, frailty, and loss of confidence. A composite patient I will call Clara, 75, from Boston, grabbed the closet door every morning and laughed it off. She said, "I just stand too fast." Then she stopped showering unless her daughter was home. That small dizziness had become a quiet prison. When she finally reported it, the review included pulse, pressure, hydration, bathroom safety, dose timing, and her full medicine list. Ask yourself, do you grab the bed, wall, sink, or chair when you stand? Have you stopped walking, showering, or going outside alone because you do not trust your balance? That is not weakness. That is a signal. Fact number 1. One blood pressure reading is not the whole truth. Do not let one frightened number become the boss of your medicine. Blood pressure changes with pain, caffeine, bladder fullness, talking, recent movement, anxiety, poor sleep, heat, posture, dehydration, and cuff technique. One high reading does not prove failure. One low reading does not prove the dose is wrong. The useful truth is the pattern. Technique matters because a wrong reading can trigger a wrong emotion, and a wrong emotion can trigger a wrong decision. Seniors are often careful, but they are rarely taught how posture, talking, a full bladder, or measuring right after walking can distort the number. The American Heart Association tells patients to sit with the back supported, feet flat, arm at heart level, stay relaxed, avoid talking, take at least 2 readings, 1 minute apart, record results, and share them with the health professional. The 2019 AHA scientific statement on blood pressure measurement explains that proper technique is central because wrong measurement leads to wrong decisions. Sprint proves the larger lesson. The pressure target matters, but safety lives in the full picture. A composite patient I will call Arthur, 72, from Street Lewis, checked pressure every time he felt anxious. Every anxious number made him more anxious. Once he almost took an extra pill out of fear. His safer change was a 7-day structured log, same chair, same arm, same time. Pulse included, symptoms included, no panic dosing. Your log should include pressure, pulse, dose time, dizziness, fatigue, near fainting, salt substitute use, NSAID use, illness, dehydration, weakness, cramps, and glucose symptoms if diabetes is part of your life. Pattern, pulse, and symptoms, not panic. What topic do you want to see next? Beta blockers and fatigue, Telmisartan and kidney labs, home blood pressure technique, or safer pain relief questions for seniors? Write the topic you want next, because your questions guide future lessons. Now let us stack the pattern. The common mistake is treating one symptom as one problem. Fatigue becomes age, dizziness becomes clumsiness, a high number becomes panic, a low number becomes skip dosing, knee pain becomes ibuprofen, Low sodium becomes potassium salt. Diarrhea becomes a weekend inconvenience. Diabetes symptoms become confusing because the racing heart is quieter. Every piece looks small alone. Together, they form the senior medication context. This is why one remedy often fails. Drinking more water does not fix a hidden potassium issue. A salt substitute does not protect you if it raises potassium in the wrong setting. A better cuff technique does not solve unreported NSAID use. A lower pressure number does not mean balance is safe. A calm heartbeat does not guarantee blood sugar is normal. A composite patient, I will call Irene, 80, from Portland, Oregon, had every object in a different room. The pill organizer sat beside the coffee maker. The cuff stayed near the television. The potassium salt substitute sat beside oatmeal. Naproxen was in the bathroom. Her glucose meter was in a drawer. Nobody was careless. The danger was that no one saw the whole table at once. Her daughter helped her make a 7-day medication context page. It was not complicated. One sheet of paper, one pen, no medical jargon. Just the truth of ordinary days, written in the order the body experienced it. Morning pressure, pulse, dose time, standing dizziness, fatigue, pain reliever use, salt substitute use, fluid intake, diarrhea or sweating, glucose symptoms. By the next appointment, Irene did not arrive with fear. She arrived with a pattern. Caregivers, this is where your kindness matters. Do not say, Mom, you are doing it wrong. Say, let us write down when it happens. Do not say, Dad, stop taking that. Say, let us ask the pharmacist what belongs together. Dignity improves when blame is replaced with observation. Many older adults hide symptoms because they fear losing independence. A gentle tracking page does the opposite. It shows the doctor how to protect independence with better information. Now the red flags. Get urgent medical help for chest pain, severe shortness of breath, fainting, new confusion, one-sided weakness, trouble speaking, sudden vision changes, severe dehydration, repeated falls, black stools, severe weakness, or a blood pressure reading above 180/120 with danger symptoms. This video is education, not a replacement for personal medical care. Never change blood pressure medicine alone. If symptoms are sudden, severe, worsening, or different from your usual pattern, do not wait for a perfect log. A log is for non-emergency review. Danger signs need direct medical help. Now for the senior blood pressure medication safety plan. Tonight, put the whole medication context in one place. Prescription bottles, pill organizer, ibuprofen, naproxen, aspirin if used, supplements, electrolyte powders, salt substitutes, herbal products, glucose supplies. Do not throw anything away. Just see the whole picture. Tomorrow morning, measure properly. Sit quietly, feet flat, back supported, arm at heart level. Do not talk. Take 2 readings 1 minute apart. Write pressure, pulse, dose time, and symptoms. This week, call your pharmacist or doctor if you take Metoprolol, Atenolol, or Telmisartan with dizziness, fatigue, low pulse, diabetes, kidney disease, diuretics, salt substitute use, NSAIDs, dehydration, or recent illness. For 2 weeks, track one trigger. Choose morning standing dizziness, noon fatigue, weekly NSAID use, salt substitute use, or sick day symptoms. Do not track forever. Track long enough to reveal the pattern. At your medication review, ask 5 questions. Is this medicine mainly slowing heart rate, lowering vessel tension, or blocking the angiotensin system? Should I track pulse? And what pulse range should make me call? Could my fatigue, dizziness, cold hands, weakness, or near fainting relate to dose, timing, or combination? Is Telmisartan safe with my salt substitute, electrolyte powder, supplement, ibuprofen, naproxen, and kidney function? If I get vomiting, diarrhea, fever, heavy sweating, or cannot drink enough, what sick day plan should I follow? Long-term, build one habit. Never bring only a number, bring the pattern. A number can open the door, but the pattern tells the doctor which room to enter. Pulse, timing, symptoms, kidney labs, potassium products, pain relievers, and sick days are the rooms where safer decisions are made. The myth is that blood pressure medicine is either good or bad. That is too simple. Another myth is that natural products, electrolyte drinks, salt substitutes, and over-the-counter pain pills are automatically safer because they are not prescriptions. Your body reads chemistry, fluid, pulse, kidney function, potassium, and timing. It does not care whether the product came from a kitchen shelf or a pharmacy shelf. The purpose is not to make you suspicious of treatment. The purpose is to make treatment safer, because controlled pressure protects the brain, heart, kidneys, and blood vessels when the whole person is being watched. That is how confidence returns one clear pattern and one safer question at once. So let us end calmly. Metoprolol and Atenolol are not just number-lowering pills, they are heart rate and workload medicines. Telmisartan is not just another pressure pill, it belongs to the angiotensin, kidney, potassium, hydration, and lab monitoring conversation. A good blood pressure number matters, but after 60, the safer plan also watches pulse, dizziness, standing balance, fatigue, diabetes warnings, potassium products, NSAID use, kidney labs, dehydration, and the pattern across days. Think back to Leonard with the missing pulse, Sophia with the quiet sugar warning, Marisol with the salt substitute, Evelyn with naproxen, Bernard with dehydration, Clara with morning dizziness, Arthur with panic readings, and Irene with objects scattered around the house. None of them needed fear. They needed context. They needed one better question at the right time. This is not just aging. This is physiology, and physiology can be understood. You are not broken because you need blood pressure medicine. You deserve to understand the medicine well enough to use it safely, stand with confidence, keep walking, sleep with less worry, protect your kidneys, prevent panic decisions, and partner with a clinician who knows your full story. Make sure you are subscribed, because a related video is coming soon on what seniors should bring to a medication review when they take blood pressure pills, pain relievers, diabetes medicine, and supplements together. That next lesson connects directly to today, and it is one many older adults need before their next appointment.